Well, 34 of Tobago's frontline workers received the Oxford-AstraZeneca COVID-19 vaccine on Saturday. Earlier this week, the Tobago Regional Health Authority received 200 doses of the 2,000 vaccines gifted from the Government of Barbados. More in this report from Caricia Douglas.
The rollout of the COVID-19 vaccine for healthcare workers in Tobago started on Saturday at the Tobago Health Center. Head of the Department of Internal Medicine at the Tobago General Hospital, Dr. Okeke, was the first to receive the COVID-19 vaccine. He was monitored for a 15-minute period and reported he felt fine. Dr. Okeke said science has given a chance to fight back, and we should take advantage of this.
Do you know who could fight back? Is with whatever else we have, and in this case, we have the vaccine. So that there's this saying that united we stand, divided we fall. A small country like Tobago, out there nowhere, is getting vaccines when most of the rest of the world has not seen vaccine yet. It's something which the government and both here and even Barbados showing that brotherliness, in this case, should be all commended for.
Head of Accidents and Emergency at the Tobago General Hospital, Dr. Ian Sammy, was up next. He said when he received word Tobago was receiving the COVID-19 vaccine, he was excited and encouraged his staff to make themselves available to be part of the process.
So personally, I know that COVID is a risk to me. I work in the emergency department. Our staff are at very high risk. So I knew that getting the vaccine was the right thing for me after looking at all the information and understanding that as with any vaccine, there is a small risk of side effects. I believed that the protection it offered far outweighed any risk.
Meanwhile, health officials informed that the 200 doses have already been fully subscribed by 100 frontline workers. General Manager Primary Care Services Dr. Roxanne Mitchell stressed that receiving this vaccine does not relinquish the need to adhere to the COVID-19 protocols.
At the end of today, we probably have about 40 persons. 40 persons do not confer immunity or what we call herd immunity on the population. So even though we receive the vaccine and the illness may not affect us individually after receiving the vaccine, the virus can still come into us and we can then transmit. It will not affect us personally, but we can still transmit. So the onus is still on us to ensure we wear our masks, we wash our hands so that we do not inadvertently transmit the vaccine to persons who are not yet protected.
Caricia Douglas for TTT News.
And staying with news from Tobago, Secretary for Health, Wellness and Family Development Tracy Davidson Celestin described Saturday's vaccine rollout as a day of celebration and hope as Tobago continues to maintain no reports of the COVID-19 cases.
Because although we have been fighting the COVID-19 for some time now, the vaccines have finally arrived into Tobago, and vaccines which can in fact reduce the transmission and the spread of the virus on the island. And so today is a red letter day for all of us, and I'm taking this opportunity once again to remind members of the public to come out and to be a part of the process, and that process is to ensure that they sign up to take their vaccines going forward.
The health secretary said she would be partaking in the second batch of vaccines, which is expected to arrive in Tobago by February 25th. Meanwhile, the Ministry of Health is reporting 10 new cases of COVID-19 in Trinidad and Tobago. According to the latest update, the positive cases reported reflects the samples taken during the period February 17th to the 19th and not the past 24 hours. The country's death toll remains at 139. At this time, there are 145 active COVID-19 cases, 12 of whom are at hospital with 2 in step-down facilities and 121 in home self-isolation.